I'm going to turn this over now to Cheryl Dinnell, who's been consulting with Arch as the facilitator of our national collaborative on implementing the national strategy. And even if you haven't been participating regularly in the strategy, this activity is still for you. It'll give you a chance to think through some of the outcomes and goals of the strategy. So without further ado, I'm handing it over to Cheryl Dinnell.
We are going to be looking at a national strategy goal on strengthening supports and services. And you're going to be randomly assigned to one of the subtopics under Goal 3 for your group. Now, each table has a couple of tools for this activity. There are markers on the table. There's instructions that are on the table. And there are also placed around the room several pieces of flip chart paper. This is the assignment. We are now 5 years into the future, and we have had highly successful results in achieving the assigned goal or outcome. And you're going to write a newspaper article about your success and how you achieved it. You're going to have a wonderful headline for your group, draft some news points for your article, and talk about how the achievement was achieved, who was part of the group, what were the players and organizations, what were their roles, what obstacles might you have encountered and overcome, and what steps were taken to achieve the outcome that you're assigned. And so we're going to ask you to think what really could happen. What really could happen if you had 5 years to work on this goal? And no fairy godmothers are allowed to come and just grant you all your wishes. But we want you to think about, as a group, how you would address this particular goal. So you're going to have about 30 minutes for your group to come up with a headline, outline how it happened, how you achieved your great success, who made it happen, the obstacles that you've overcome, and then how it's going to benefit caregivers for your article. The markers are to display your headline and your bullet points or your information. You can do graphics, whatever you want to do, but you're going to just come from each of your group. We're going to have you come and take an assignment, or actually maybe it'll be quicker if I just walk around and hand you one randomly. Any questions at this point? Okay. Your group needs to just look and review that particular goal. It's different from everyone else's, so you don't. If you've had great success in that, you can do a timeline back from when you started and build that into what you've already done. But if you'll get going on your groups, I'm starting the timer. You got 30 minutes. And then we're going to have you report out each group. So somebody's got to be the brave person who comes up and shares your flip chart paper. All right. Here we go. Our first presentation. Will you each introduce yourselves and then share your headline? I don't know if they will fit maybe even just across there for camera purposes. Do you need them to hold them up high? Do you need them higher? Okay, all right, if you'll just hold them up high, you can get a good picture of them for that, and then we'll give you 3 minutes and to introduce your headline and your ideas, okay?
I am Alexis, I'm from the state of North Dakota, and my group was group outcome 3.8. So our headline, done, is President Kagan, where's our president? She disappeared on me. Oh, there she is. President Kagan announced today the results of the 5-year funding that provided all states a future planning tool. So thank you, President Kagan. All right, so what our tool did is it expanded on No Wrong Door, and it is the future planning tool available on the Arch website. Thank you. You're welcome, Jill. I'll put a plug-in for Arch up here for you. So a great tool if you want to know more about that. Lisa can tell you about that. She's very knowledgeable on that. So we expanded this, and we partnered with ACL and ARCH and state agencies to make this more widely available. And the marketing strategy with this is saying that the future is now. Caregivers, the biggest obstacle to utilizing this tool is that they don't have time, that they're working, that they're a full-time caregiver. So in our marketing campaign, we said the future is now, and we gave grant funding. Did we decide an amount for that? $5,000 per caregiver to allow them respite and allow them the time to do this training. In a nutshell, it's basically financial planning. It's very all-encompassing planning to allow them to do that in the now. And our last highlight with that is that it's multi-platform. So I know technology can be a burden for caregivers, sometimes especially kinship caregivers. So they can actually call in to do this tool as well. It will still be available for those that are tech savvy, but they can call in and through the ADRL or through No Wrong Door that many states have implemented, they can access it. They can access it through that. So I think that's all I have.
Wonderful.
Are your arms getting tired?
No, I'll be glad to do this.
Okay, thank you. Hi, I'm Amy from Colorado. Our group was 3.6, which is around volunteers. I can't remember exactly what it says, but that there'll be a volunteer workforce of all ages. It's fully vetted, something to that effect. So our headline is, "Come one, come all for respite provider training." And basically we thought about the presentation we just received before this from Wisconsin about their respite provider training and talked about making it fully accessible to people of all different types of abilities and curating it also for all ages so that you can have different content that's more programmable for younger caregivers. And then we also talked about a program to incorporate fraternities, sororities, and high schools who have required community service requirements to use those requirements through respite, to fulfill those requirements through respite. And that can be for both kids as the care recipient as well as older adults, so it can get some intergenerational stuff there too. Workers can now use work time to volunteer. Period. AmeriCorps Senior Companion Program is now expanded, so the Senior Companion Program, you may be familiar with it, is basically seniors hanging out with seniors. My grandma had that before she died a little while ago, but her friend came over and would read her books and stuff. It was really great. So now that program has been expanded to connect the senior volunteers with children so that there's intergenerational programming there too. And then caregiver coaches are now available free of charge. These are volunteer caregiver coaches who are folks to help prepare caregivers to receive the respite of all these people that are available to provide it. So we're providing pathways to careers. Everyone can help no matter who you are. And the world is all fixed.
Oops. We spend a lot of time talking and not so much time writing. So I will try to fill in the gaps as much as possible. Our outcome was 3.3. A range of evidence-based education, counseling, and peer support services are available to family caregivers. So lots of different topics kind of all under one heading. So we came up with, you are not alone, bringing caregiver support to you. So we wanted to make sure that caregivers, number one, identified themselves as caregivers, so that's why we were using that kind of headline, as we all know that caregivers oftentimes don't even recognize that. We also wanted to talk about the range of evidence-based services that are available. So some of those services here that we listed were TruAlta, Powerful Tools, and there are a range of other supports that are also available, so those were added in. In addition, we thought family mediation would be helpful because, as we know, sometimes families don't get along so well, especially during crisis or other kinds of times of stress. So we wanted to make sure that there were some supports to support families in that way. And then we talked about some of the other counseling and peer support activities that are available. For example, There might be a caregiver night where the caregiver can go and participate in kind of a support activity together, and then maybe the care receiver can also attend, and we could break it into different age categories or different needs or whatnot for the care receivers, because as we know, some care receivers are children and some are the elders, and so we want to make sure that it's appropriate for each of those activity levels, but we were including that as well. I'm trying to ad lib here with some of the things we talked about, so bear with me. Anything that I left out? Funding. We all talked about the need to increase stable funding, to increase respite vouchers and other respite opportunities. So we wanted to have diverse funding sources, major funders, federal money, state money, all of the above. So that, I think, kind of ties it all into bringing caregiver support to you.
Did you introduce yourself?
Oh, I'm Rosalind Albert from Washington State. Thanks.
Introduce yourself.
Hi, I'm also from Washington State, just randomly, and I'm Barb Kumjan, and we had outcome 3.1. So that's person and family-centered, trauma-informed, and culturally appropriate caregiver services and supports are accessible to all caregivers. So I'll talk more about the model, but let's jump right into the headlines. Caregiver Helpline breaks national records. Any family caregiver caring for an individual of any age, call 1-800-123-4567 or text #891 for support and free or low-cost respite. We speak your language. We live in your community. Choose your own provider. Those providers should be trained in the National Respite Care Provider Program, training program, okay? So we envision, this is statewide, we envisioned a statewide registry where caregivers are going to go through the training. They are going to share at their comfort level what their cultural and linguistic background is. The registry is open to anyone who calls that number, hashtags, or clicks on the beautifully designed QR code there. Don't take a picture of it. It's going to send you a rabbit hole. And where was I? So the respite registry, and part of the training, I mean, we're not guaranteeing, when we talk about trauma-informed, we are not guaranteeing that the staff that come to people as respite providers are going to be able to be, give therapeutic services, but they will be trauma-informed. They are not going to step on those toes. And since people can self-direct and choose their own providers, they are more than likely to find someone who maybe speaks their language of origin or comes from their tribal community in order to make this happen. The biggest barriers, of course, were finding these people, because we're presupposing that we have the money with, thank you, Roz, a very good and diverse, not only government funding stream to make this happen for generous respite care payments to caregivers, but we were presupposing that, we could not do this alone. So we've modeled on various around the table. Thank you, table over here. Wave your hands so we all know how good we are. Models of community outreach that all of us were already doing in terms of outreach to tribal organizations, to community organizations. Our own program has just finished a focus group for a pilot program for respite camps. through a different funding stream than ACL. So we're just pulling from a massive amount of outreach, which was our major barrier, that and persuading the major financial corporations in the state that a family caregiver with respite is a family caregiver that stays in your employ. All right.
Thank you. All right, who's next? Are you guys ready? We got a couple others. Introduce yourself.
Okay, I'm Nick from Virginia, and I'm the spokesperson for our table today. And I wrote it, so it's probably better if I read it. I actually wrote you a whole article, because that was the goal, so I'm going to read my article until we get to the paywall. So I can't tell you any more than that. So, caregivers finally get the support they deserve, is my catchy headline here. And new federal and state government initiatives, supported by caregiver coalitions, respite professionals, and family caregivers, provide increased funding to respite and caregiver services, which is just general enough to, get your attention. The IRS recently lifted the tax reporting threshold from $600 to $10,000. Yeah. Additional federal funds would provide increased pay rates to providers, which include travel time and mileage to reach rural individuals, increased training and certification, a respite registry that provides a one-stop shop for respite across the lifespan. The registry lists providers from supervision to skilled nursing to recreational respite providers. The new respite system is fully staffed with any provider you may need, and allows for various payment methods from vouchers to direct payments to others, and then, well, you can't have to learn more by paying, so yeah, that's what we got. That's what we got. Also, we had 3.2 is.
Here's your goal. Hey, are we ready?
Oh, I'm not need to see it. Okay. Hi, I'm Jenny from South Carolina, and our group had outcome 3.7, which is that family caregivers and care recipients' needs are a key consideration in emergency response efforts. So we developed a program. Our headline is 911 State Care, helping caregivers navigating emergencies like tornadoes and hurricanes and other natural disasters. Our first step in all of this was to develop a toolkit for family caregivers specific to their area and the type of disasters that they might come across, like a general caregiver's guide for disaster planning. After we did that part, we realized they're going to need money and resources to implement the things in the guide. So we found some grants and endowment funding, and money was not an issue. And we developed a program where caregivers could have a home assessment to evaluate their emergency safety plan and help develop a safety plan for their particular situation. Once they went through that assessment, they got a 3-day safety kit, or a 3-day emergency kit for the caregiver and the care recipient. If they needed a backup generator because of electricity and medical equipment, we're providing that. And if they need an accessible storm shelter because they live in like a tornado or a hurricane area, we did that too. The training along with that storm shelter comes with training for the family caregiver and practice drills. We also developed a registry to check on people after any kind of disaster, and a notification system that caregivers can sign up, or really anyone can sign up for, to let them know a storm is coming or something's coming. So our post-disaster plan includes counseling for mental health and for how to navigate things like FEMA assistance and all that other stuff I don't know how to do right now. We had a ton of interagency collaboration on this. We worked with all our emergency management divisions. We worked with FEMA, our state government, federal government, everybody's involved. And to tie it all back to respite, we are also offering emergency planning respite vouchers to help out during the assessment process, during any kind of home construction, during the FEMA claim period, and like if people have to relocate, offering respite to help get you set up in your temporary housing while you're trying to move all your stuff and get everything situated. We said $20,000 per family, but since we have all the money in the world, the sky's the limit, and yeah. Our challenges were initially finding funding, but once we found all that money, we were good. But I think one thing is finding case managers and care people who can help people walk through that process. Let's see. And also finding staff to do that. That's...
Well, I don't know if Lori got all of that. All right, very good. Well, look what a group of dedicated, informed people, even if you're well-seasoned or new and fresh perspectives, how we can bounce ideas off of each other, how we can link arms and say, here's the solution, and come up with some really interesting strategies. Funding is, that grant fairy godmother kind of a request, but the effort that we know that we need to make in pulling the pieces together to make some of these dreams a reality. And so I really appreciate all of your participation and hard work. And now you can go make back friends with the people that you like to sit next to for lunch, which we were going to be breaking for here in just a moment, unless we had any other announcements. I assume everyone's found the restrooms. You know where those are located. And we'll be serving lunch here momentarily.